Good afternoon. Thanks for joining us across the fence. I'm Fran Stoddard. Our focus today is on one of the most underreported crimes in the country and here in Vermont. I'm talking about elder abuse. Last year, Vermont's Adult Protective Services confirmed nearly 200 cases of abuse, exploitation, or neglect. That's more than 3 per week every week. And Protective Services notes that overall cases are likely underreported. To learn more, we're joined by 2 guests from the University of Vermont Medical Center. Dr. Mariah McNamara is an emergency medicine physician who works in the emergency department. And Sister Pat McKittrick is a registered nurse who has spent 27 years at the medical center and is a member of the Sisters of Providence. Thank you both so much for being with us.
Thank you.
So I want to be sure we all understand what we're talking about when we use the phrase elderly abuse. So Dr. McNamara, what is elder abuse, and perhaps more importantly, what is it not?
Yeah, thank you, Fran. So elder abuse is really not about age, actually. So most elders and people who are living with disabilities successfully do manage their own lives and are capable of providing for themselves and their safety. Really, it's about vulnerability. So there is a Vermont statute that speaks to vulnerability, and it includes things such as residents of a licensed facility in Vermont, such as a nursing facility. Psychiatric hospitals are involved, or if the person has a personal care attendant for longer than the month. Basically, if somebody is impaired as a result of a medical condition or disability, aging, mental health issue, and is unable to provide for their basic needs, that would be a person considered vulnerable. So vulnerable adult abuse or neglect can take the forms of both neglect, also exploitation. Things like financial exploitation is one common example, or other types of abuse, such as physical abuse, psychological abuse, or even sexual abuse.
Wow. So, Sister Pat, we mentioned, like, an average of 3 cases a week. But in Vermont, what more do we know about elder abuse in Vermont?
Well, I think if there was any benefit from the COVID situation, it was that we realized how important our connectedness is, and how unfortunately in a lot of facilities people were disconnected from their families and friends and advocates. So we realized the importance of social connectedness, the importance of advocacy, and that it's a team effort that we need to make, and that it's always patient-centered. We have to really be attentive to the people and pay attention to what's going on. This is not something new. It has been going on for a long time. It's just more obvious more recently.
Sure. So, Mariah, what kinds of situations puts people at risk or makes people vulnerable to abuse?
Yeah, so some of the things that we see that we think does put people at risk and are more vulnerable are a lack of social supports. So that social connectedness that Sister Pat just mentioned, I think is really critical. Also, increasing age, dementia, or cognitive decline, we know increases vulnerability to this abuse. Alcohol or substance abuse can be an important aspect as well. And difficulties managing finances put people at risk too.
Sure. And so, Sister Pat, are there policies or safety nets that help identify and deal with abuse?
There are. There's mandated reporting. So any nurse or aide that's working in a facility that has any type of state funding must report any suspected abuse or neglect. It's up to the Adult Protective Services at that moment then to investigate. And you don't have to substantiate it. You just have to say, you have a reasonable reason to think that they are being abused. And then the Adult Protective Services will come in and take a look. So that's one of the ways. And then also to make sure that people are being trained adequately. During the pandemic, we've seen that we've brought people in off the street, trying to help out, taking people, and they haven't been trained adequately. And also, I think that the recognition that there's inequity in salaries, that people are not being paid sufficiently for the work that they're doing. There's a terrible discrepancy and a real gap, and we need to look at that.
Absolutely. So caregivers are really key here. And how does one advocate for a person that you might be concerned about as being abused, neglected, or exploited, Mariah?
Well,
Yeah, so I think if there's a concern about that, certainly engaging with the person is important and encouraging that connectedness among multiple people. Having more than one caregiver can be really helpful and important, making sure that there's emergency caregiving for backup. Making sure that the support for that person is there and checking in frequently. There are options for reaching out and getting connected with services online. Of course, there's many great resources, but you can also reach out to our primary care network. We have great case managers, social workers who are very knowledgeable about support in the community, both for vulnerable adults as well as for their caregivers.
And so just to follow up, it's very awkward, but what about cases where it's a family member that might be causing the abuse? What can we do? Mariah?
So family members, unfortunately, do make up a fair number of the reports of abuse. And when it is a family member, I think it's all the more important to support the vulnerable person with that connectedness. It may be other family members, it may be community members, but recognizing that family members can also, unfortunately, be the perpetrators of abuse is important to realize. And it's important also, again, to make sure that caregivers are supported in their roles and making sure that it's not just one person who can care for another. We really do need to look at this as something that our whole community needs to be engaged with.
Absolutely. So, Sister Pat, talk a little bit about what is mandatory reporting and what does it mean, and who is required to report?
okay, so anyone who is licensed by the state or that is working in a facility that has any kind of state funding is required to report anything that they see or suspect as abuse, neglect, or exploitation. They must do that. There are state surveys that come in and surveyors that come in and they'll look around and see what's going on. And there's also the Office of Professional Regulation. So what happens there is the Office of Professional Regulation oversees licenses for nurses, aides, administrators. So if you have an issue specifically about a nurse or a caregiver, you would report that to the Office of Professional Regulation because they are the ones that would come in and investigate at that point.
And I take it there is oversight for hospitals and nursing homes kind of under the same umbrella.
Right. There's the Center for Medical Services. That Mariah would be better to tell you that about the hospital. Who comes in there?
Mariah?
Yes, we do. We have a number of regulatory bodies, and the Center for Medicaid and Medicare Services is certainly one of them. All of our health providers are mandatory reporters, and what that means for us is that we need to put in a report. We're mandated to report to Adult Protective Services within 48 hours of recognizing a concern. And like Sister Pat mentioned, it's a concern that we're mandated to report, not a substantiated situation. There may be uncertainty, but we do require that health providers do report when there's concerns. And that reporting can be online, it can be a phone call, it can be an email. It's actually, there's a number of ways to make those reports. And it's the sort of thing that even non-health providers or other non-mandatory reporters can make reports to APS when there's concerns out there.
So what happens when somebody who might not be a regular caregiver calls Adult Protective Services? Mariah?
I would say that the Adult Protective Services, they may actually have you leave information, and it's important to leave the information that's going to be important for them to start their investigation or looking into a situation. What they're going to want to know is whether or not the person is considered vulnerable under state statute. And they're also going to want to know some of the concerns around, was it abuse, neglect, or exploitation that was occurring. So those phone calls can be very helpful, very important, and leaving a contact number and your information to call back is certainly helpful as well for them to be able to start looking into the situation.
Sure. Well, determination, I'm sure, is pretty tricky. And Sister Platt, let's follow up with the issue of social isolation, since this is especially an issue during COVID. How can we better recognize, prevent, or avoid just neglect, much less abuse?
I think some of the things like mental stimulation is really important. How do we make sure that people are being stimulated? Because there's fewer staff members, so it might mean more telephone calls from people outside, letting them know that you're checking in on them and talking to people, making sure that if there's puzzles or things that they like to do to keep their mind active, and always having a holistic approach, body, mind, and spirit, so that you're looking at the whole person and not just one part. Every part is important. And to be sure that we're training people adequately to recognize this and to go in and to intervene, and to, if they have a few minutes, go in and talk to somebody. Don't just sit, talking to another aide. Go in and visit with some of the patients. Make sure that they realize they are important. I think that's really pretty much, and also being very careful about who you choose as caregivers, and if you have someone at home that's being cared for, have multiple caregivers. Don't make it a predictable situation where you always come home at the same time. Check in more regularly, some phone calls, and listen to the person that's being cared for. They have input, and make sure you're listening to what they say and try to validate what's going on.
Absolutely, and let's make sure that we support our caregivers. We're out of time, so I want to make sure people have the toll-free number for Vermont's Adult Protective Services. That number is 1-800-564-1612. That's 564-1612. Thank you so much, Dr. Mariah McNamara and Sister Pat McKittrick.
Thank you.
Thank you.
And once again, thank you for joining us across the fence. Be kind, stay well.